Hello everybody, welcome back to our channel Nursing Career Club. Today we will discuss about Home Health Aid Unit 9, Patient Positioning and Ambulation at Home. Introduction. As a home health aide, you play a vital role in assisting clients with positioning and ambulation, promoting their comfort, safety and mobility. A home health aide plays a crucial role in transferring patients from one place to another place with the help of wheelchair. So this is very comfortable for the patients, and the patients can be mobilized easily from one place to another place. The patient is positioned semi-upright with the head of the bed elevated 45 to 60 degrees, and the patient's bed should be up at the angle of 45 degree to 60 degrees, and there should be a pillow under the patient's head. This position is helpful for patients with respiratory issues or those who have difficulty swallowing. So this position plays an important role with the patients who have problem in respiratory system, and they also feel difficulty in swallowing, inhaling the air. Ambulation. It is the process of patient walking, standing, or moving after illness, treatment, or surgery. Ambulation is such a thing that when a HHA helps the patient in moving from one place to another place with the help of walker, stretches, and cultures. So this is called ambulation. It helps to maintain muscle tone, muscle strength, and joint flexibility. Ambulation helps the patient in their muscles. They can get an improvement in their muscles and joint flexibility, and their joints can be flexible in working. It stimulates the respiratory, circulatory, and gastrointestinal system to allow for prospering functioning. It also organizes the respiratory or circulatory and the gastrointestinal system for the proper functioning of the body parts, so that a patient can be free from various diseases such as respiratory and circulatory systems. Positioning. Now we will discuss about positioning. It is the placement patient in positions which either promote healing, prevent injury, or both. It helps the patient's positioning. If a patient is feeling well and he needs to be prevented from injury and both things, the patient uses a walker to provide stability and support while working, and a patient uses a walker to walk from one place to another place and with the stability, and without any interference a patient can move from one place to another place with the help of walker. The walker should be at the waist height, and the patient should be instructed to move the walker first, then step into it. And the length of walker should be around the waist of the patient, and we should instruct the patient to move the walker first. After that, he or she should go into it, and with the help of walker, the patient should walk slow. There are several positions: Tendelberg position, supine position, prone position, lateral position, Fowler position, lithomy position. Various types of positions and postures to be maintained ideal for various procedures. Patient positioning involves properly maintaining a patient's neutral body alignment by preventing hypertension and extreme lateral rotation to prevent complications of immobility and injury. So, a patient's positions include the proper maintaining of patient's immovable body and alignment of the body parts, and it is also helpful in the rotation of moving criteria, and it also improves the mobility from one place to another place without any injury and without any hindrance. Positioning patients is an essential aspect of nursing practice and a responsibility of the registered nurse. And a HHA sets the patient in moving from one place to another place, and the HHA also focuses on the health of the patient, and he also knows very well that how can a patient be recovered from the disease, and it is the responsibility of the HHA to move the patient from one place to another place. Manual transfer. The provider positions his her legs on the outsides of the patient's legs. As the patient leans forward, bending at the waist, the provider grasps the gait belt, and while a patient is bending down, then the HHA should grasp the patient from the waist and also maintain the body control of the patient. That a patient should not be fall down and easily transferred from one place to another place. Help the patient shift weight in a rocking motion, front foot to back foot, and so on until reaching a standing position. It also helps to control on the patient's weight and the velocity of the patient. And a patient can move slowly from one place to another place in a regular motion with the help of foot, and he can walk slow with the help of walker, and he can also stand in a proper way with the help of walker. This is all about manual transfer. Mechanical transfer devices. There are several mechanical transfer devices like a crutches, wheelchair, and a bed. There is a gate belt on the wheelchair and a slide board so that a patient can sit properly on the wheelchair, and the HHA should apply the gate belt to the patient so that a patient can be mobilized easily from one place to another place. Assistive mobility devices. In general, advance the device, then the affected side, and finally the non-affected side. There are two sides. One is affected and second one is non-affected. So the affected part of the patient is called affected side, and if a non-affective part, that is called non-affected side. As you gain confidence, transition to a more natural gait by moving the device and affected side together. It is a crucial confidence in the transition of a patient with the help of HHA by using gait and moving the device and affected the both sides together. Stairs can be challenging, so always use a railing if available. Railings offer better stability and support. If we are going on the another floor of the building, then the patient should use the railings, and a patient and a HHA should take the help of railings because railings are better than the stairs. So it is very mandatory to take the help of railings for the proper stability and for the proper support. This is all about assistive mobility devices. Other transfer. There are various transfers that a HHA takes the help when he transfers the patient from one place to another place with the help of walker, with the help of bed, and with the help of crutches. This is all about other transfer. Prevention of complications. Risks to patient in lateral position include pressure to points on the dependent side of the body such as ears, shoulders, ribs, hips, knees, and ankles as well as a brachial plexus injury, venous pooling, diminished lung capacity and DVT. There are many risks which are which a patient have to face, and a HHA help the patient to keep away from these injuries. Like as the injuries can happen in the ears, at the shoulders, at the ribs, at the hips, and at the knees, and as well as ankles. So, HHA plays an important role to keep away the patient from these in happenings, and a patient can be recovered very soon with the help of a HHA. A pressure reducing or mattress or tabletop pad should be used as needed, and proper bedding is used for the treatment of a patient, and there should be a tabletop pad on the table as needed by the doctors or nurses. Facilitation of healing. Now, how can we facilitate the healing? Healing, we can define this word that a patient is a getting a recovery from the disease. So, healing can be defined as a help of a patient with various devices, and a HHA helps the patient in recovering very soon, and he also make patient strong emotionally so that a patient can recover from the injury very soon. Respiratory function. Functions of respiratory system. O2 and CO2 exchange between blood and air. Speech and other vocalizations, smell, pH regulates CO2. Now, respiratory system related to the inhalation of and exhalation of air. A human inhale O2 and exhale CO2. This is the exhale system, and blood pressure. Vasoconstrictor, angiotensin, pressure gradients, flow of lymph and venous blood expulsion, expel abdominal contents during urination, defecation, and childbirth. So our blood pressure, we can check our blood pressure with the help of BP instrument, and our blood pressure should be in the criteria of its normal frequency. If our blood pressure is high, then it is the cause of a disease, and our body may be weak. So blood pressure should be in a proper range. And expulsion is related to the contents which are helpful while urination, defecation, and childbirth. This is all about respiratory function. Now we will talk about pain management. How can we manage our pain? With the help of various creams that helps the in pain management, and we should also take painkillers time to time so that our pain can be reduced in the time frame. So this is all about pain management. Prevention of aspiration and dysphagia. Although swallowing difficulties can't be prevented, you can reduce your risk of occasional difficulty swallowing by eating slowly and chewing your food well. Now, how can you prevent from aspiration? If you are chewing your food many times and slowly, then it can be helpful in the prevention of aspiration. If we are eating food fastly, then it can hamper our digestive system, and it can be a cause of several diseases. However, if you have symptoms of dysphagia, see a healthcare professional. If you have dysphagia, then you should go to the doctor and consult about the dysphagia, and you also should take the medicines for the proper treatment of dysphagia. If you have GERD, see a healthcare professional for treatment. If you have symptoms of GERD, then you should see a doctor for your health care, and the doctor will give you instruction to take nutritious food and do exercises on the daily basis. So this is all about prevention of aspiration, enhanced monitoring and intervention. Now monitoring can be related as a control. If a HHA controls on the movement of the patient, then it can be called as a enhanced monitoring and intervention. And the time frame and the duration of time is called intervention. At what time a HHA helping a patient in taking medicines and for the mobilization of the patient from one place to another place. Positioning for patient. We have earlier talked about positioning. The goals of proper patient positioning include maintain the patient's airway and circulation throughout the procedure. And a proper positioning is such in such a way that a HHA maintain the patient's airway and the blood circulation in the body, and also blood pressure. And a patient is likely to be nerve damaged, then the HHA should also focus on nervous system, allow surgeon accessibility to the surgical site as well as for anesthetic administration. So we allow a surgeon to be accessible for the surgical interaction with the patient, and a doctor uses a anesthetic for the patient for a proper surgery without any pain. This is all about positioning for patient, treatment and recovery. So treatment, we can say that treatment is such a thing that when a HHA and doctors and nurses give their best for the treatment of a patient, and they also provide various medicines on time to time for the recovery of the patient, and with the use of various positioning and medicines, a patient recovers very soon. So this is all about treatment and recovery. Assessment. Now we can say that a assessment can be called as a test. A pillow or head positioner should be placed under the patient's head with the dependent ear assessed after positioning. While A HHA helping a patient in positioning, then the HHA should apply a pillow under the head of patient and at a proper angle. So patient should be comfortable on the beddings and his ears should be comfortable after positioning. The patient's physiologic, spinal, and neck alignment should be maintained during the procedure, and a safety restraint should be secured across the patient's hips. And the patient's physical state should be in a proper way, and spinal and neck alignment should be erected and in a straight position so that a patient can feel better than the, better than ever. And a HHA should use safety restraints to secure the maintenance of the patient's body and patient's body parts. This is all about assessment. Now we will talk about preparation. So, a HHA should be prepared for the treatment of a patient at the treatment area or in a ward. There should be a proper bedding for the patient, and near the bed, a wheelchair should be put because a wheelchair can be used at any time. So, a HHA should be prepared to face with any kind of situation while the treatment of a patient. Positioning. We have earlier talked about positioning. In medical terms, position relates to body position or posture. So, positioning we can define it as a that in which position a patient sleeping or sitting and standing. So, this is related to the positioning. Positioning involves placing the patient into a specific static alignments. So, positioning plays an important role in placing a patient in a static alignment and the hands and legs in a good position. Positioning can involve the patient's entire body or a single limb. So, positioning plays a crucial role in the patient body movement or a single limb movement. This is all about positioning. Now we will talk about transfer. We have earlier talked about transfer that a HHA can transfer a patient from one place to another place with the help of wheelchair, with the help of crutches, and with the help of a stretcher. So a HHA should be careful while transferring a patient from one place to another place. So this is all about transfer. Adjustment. There are many patient positions that medical professional use. So there are various types of positioning which are used in the medical field by a HHA or the nurses and doctors. This includes supine, prone, lateral, Fowler, lithomy, Tendelberg, reserve, Tendelberg, and Sims. So we have earlier talked about various positionings like a supine, prone, lateral, Fowler's, lithomy, Tendelberg, reverse Tendelberg, and Sims. Each position has various benefits depending on the types of procedure and the needs of the patient. So each position depends on the patient that in which way a patient is lying on the bed or standing position or in a sitting position. So this is all about adjustment. Now we will talk about transfer back to bed. A HHA uses a wheelchair to transfer a patient from wheelchair to the bed. and the patient should be transferred very comfortably without any injury and without any hindrance. Repositioning. It is also important to repositioning the patient in order to both change the areas that are load bearing and as much as possible. So repositioning plays an important role in a proper positioning of a patient. First of all, a HHA transfer a patient from one place to another place, and he also uses various tricks to reposition the patient. Increase the surface area of the body that is supporting the load, and the area of the body can be increased which can be supportable for the body to bearing the load while avoiding positioning on the most at risk areas, for example the bony prominences and most at risk areas. There are several risk areas, for example the bony prominences. This is all about repositioning. Post transfer assessment. Now we will talk about post transfer assessment. When a patient is mobilized from one place to another place with the help of wheelchair, then this total work is called post transfer assessment, and the nurses and the doctors assess the transfer at the end of their thought process, that is called post transfer assessment. Physical health. Long term physical conditions are those which can't currently be cured but can be managed with medication or other treatment. So, physical health is very necessary to live in a proper way. If our physical health is good, then our mental health will also be good. So, if we have any disease or any mishappening and any disorders, so at that moment we should take proper medicines to keep our physical health in a good condition. They are also known as chronic conditions. Examples include diabetes, asthma, arthritis, epilepsy, chronic fatigue, and high blood pressure. And there are many chronic disorder conditions which includes as a diabetes, asthma, arthritis, epilepsy, chronic fatigue, and high blood pressure. And our blood pressure should be reduced with the help of medicines and with the help of doing exercises in the morning and in the evening. Cardiovascular health. It is related to our heart, that it how many times our heart beating in a 1 minute, and what is the circulation of blood in our heart. So that is related to cardiovascular health. Mental health. Overview. Mental illness, also called mental health disorders, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. If our physical health is not good, then our health will also be bad, in a bad condition, and it will impart a deep effect on our mental health. If we are in a depression or we are in a stress condition, then our mood will be off, and it will be effective for our thinking and behavior process as well. So we should be in a good situation of mind, and we should always be positive with our daily activities. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. There are many examples of the mental illness. including depression. Depression means that we are thinking and with a load, and there is a load on our mind of thoughts, that is called depression. And anxiety, if there is a change in our behavior, we are irritating with each other, then it is an anxiety disorder. Schizophrenia is also related are mental disorders. There are many eating disorders and addictive behaviors. Like many people addicted to drink wine and chewing tobacco and smoking also. So these things impart a deep effect on our mental health. Improved cognitive function. If we talk about improved cognitive function, this function related to our sensitive organs and our nervous system also. And this cognitive function plays a crucial role in our nervous system, and our nervous system is related to our brain, and this nervous system send messages to the brain. If we have any injury, then our nervous system send a message to our brain. This is all about improved cognitive function. Enhanced mood, a state or quality of feeling at a particular time. What's the boss mood today? So if we talk about mood, and our mood changes at any times and at any situations, and it depends on the situation of a individual, that throughout which conditions a individual passing. So in the good situations, mood can be good, and a person is suffering from bad conditions, then his mood will be off. Synonyms: state of mind, frame of mind, disposition, humor, temper. And this these things change the state of mind, frame of mind, and it can be a cause of disposition. And it can also affect our humor and temper as well. A distinctive emotional quality of character. The mood of the music was almost fun, real. There are good emotions and bad emotions. If we are enjoying our day, then our mood will be in a good condition. If we are suffering from a bad situation, then our mood will be off, and we will be in a depression or stress condition. Now we will talk about social connection. If we meet with our friends in a park and we play various games, and if when we go to office, then we see our colleagues and we also talk with them and spend our day with our day work. And a patient goes to hospital and he meets with doctors and nurses, and there is an interaction between the doctors and patients. So this is called social connection, and our social connection should be in a proper way, that we can face various kinds of situations which occurs in our life. Increased energy levels. If it is at a higher energy level, it is said to be excited, or any electrons that have higher energy than the ground state are excited. When a person in a excited situation, when he gets a profit or loss, if a person gets a profit in his or her business, then he will be excited, more excited. Like as the electrons are excited when the electricity flows via the wires, then there will be a excitement state. Such a species can be excited to a higher energy level by absorbing a photon whose energy is equal to the energy difference between the levels. If we talk about photons energy, so it is related to the transfer of energy from one molecule to another molecule, and the elements of the photon which are related to the energy levels. So the energy level can be from bottom to up, and there should be a time frame of energy. Now we will talk about longevity. Longevity is related to our body functions and our health situation. If we are healthy, then our life will be long and we will feel longevity, and a person is free from various diseases and he takes light food and do exercises on the daily basis, then he can be in the line of longevity. Thank you for watching our video. I hope that this video will be helpful for you. If you want to ask a question, then you can comment in our comment section, and if you want to take our notes, then you can visit on our official website www.nursingcareerclub.com. Thank you again for watching this video. Please like, subscribe and share this video. We will see you in the next video.